Welcome to this module on gross motor skills. Whether you're just starting out in early childhood education or you're adding to what you already know, understanding how children develop physical skills is foundational to your work. The things that happen in a child's first 5 years physically set the stage for everything that follows. In this video, we're going to walk through gross motor development from birth all the way to age 5. We'll talk about what to expect at each stage, what you can do to support children's development, and what signs might suggest a child needs a little extra attention. Let's get started. Before we dive into milestones, let's make sure we're on the same page about what gross motor skills actually are. Gross motor skills involve the large muscles of the body, the legs, the arms, and the torso. We're talking about all the big whole body movements: rolling, crawling, walking, running, jumping, throwing, and balancing. And here's something important to know right from the start. Physical development is not just something that happens on its own. Yes, children are biologically wired to develop these skills, but they need opportunity, space, and support from the caring adults in their lives. That's where you come in. Gross motor skills fall into 3 categories: locomotion, moving from one place to another, like crawling, walking, running, or jumping. Manipulative, giving and receiving objects with force, like throwing, catching, or kicking. And stability, controlling the body, like balancing, stopping and starting, and riding toys. Keep these in mind as we move through the age ranges today. You'll often hear 2 terms in your work: gross motor and fine motor. We're focusing on gross motor here for these slides, but it helps to know how they relate. Gross motor development, the big muscles, always comes first. A baby needs core strength and shoulder stability before they can develop the precise movements in their hands and fingers. You can't rush fine motor skills if the gross motor foundation isn't there yet. Think of it like building a house. The gross motor skills are the foundation. Fine motor skills are the finishing work that comes later. Both matter, and we'll explore fine motor skills in a separate video. Here's something that sometimes surprises people. Gross motor development is deeply connected to every other area of development. When a toddler learns to run and jump, they're also building confidence. When a preschooler learns to skip, research actually shows they're supporting reading readiness. Physical activity improves attention spans and academic readiness, and this is backed by research from the CDEC. Gross and fine motor development require 4 key things: strength, which children build simply through trying; stamina, the ability to keep going, which for young children is really about engagement and interest; flexibility, which young children actually have in abundance; and agility, the ease and quickness that comes with confidence and practice. The takeaway here is that the time you spend on physical development in your setting is not extra. It is core to your work as an early childhood educator. Let's start at the very beginning. In a baby's first 8 months of life, the amount of physical development that takes place is truly remarkable. More physical development occurs between birth and 35 months than at any other time in life, so these early months matter tremendously. When babies are born, their movement starts at the top. This is called cephalocaudal development, which just means head to tail. First, babies control their heads, then their upper bodies, and then their lower bodies. In the first month or 2, you'll see babies turning their heads from side to side. Around 2 months, they can hold their head up briefly. By 4 to 5 months, most babies are beginning to roll, usually belly to back first, because that direction takes a little less strength. By 6 months, they can prop themselves up on their arms while on their stomachs. By 7 to 8 months, babies can get into and out of a sitting position, using both hands to explore a toy and scoot across the floor. They're building up to standing at around 10 to 12 months and walking by 12 to 16 months. Now, these ranges are for typically developing babies. They're not rigid rules. Every child will have their own timeline. Let's spend a moment on tummy time because it comes up so often and it's so important. Since 1994, the recommendation has been that babies sleep on their backs to reduce the risk of SIDS, sudden infant death syndrome. This is a life-saving recommendation, and we absolutely follow it. But the unintended side effect is that many babies now spend less time on their stomachs overall, and tummy time, supervised, awake tummy time, is essential for building the neck, shoulder, and upper body strength that babies need to roll, crawl, sit, and eventually walk. Many parents tell us their baby hates tummy time. It's really common. Babies often fuss because they're working hard. Those muscles are still developing. The key is to start early. Start with short sessions of just 1 to 2 minutes and use things that will motivate the baby. A colorful toy, just out of reach, or getting down on the floor face to face with them. When babies are motivated, they work. As educators, you can share this information with families. Many don't realize that back to sleep and tummy to play are two separate things. Between 9 and 17 months, we officially enter the mobile infant stage, and that name says it all. These babies are movers. Your job is to give them safe, interesting places to move. From 9 to 12 months, babies are typically sitting independently, crawling on hands and knees, pulling themselves up to stand using furniture, and maybe beginning to cruise, which is walking while holding on to things. Some babies begin walking independently right at 12 months. Others don't walk until 15 or 16 months, and that's completely typical. Between 12 and 17 months, walking will mature. Early walkers often look a little bit wobbly. They walk with their feet wide apart, arms out for balance. That is normal. You'll also see them throwing balls, pulling toys while walking backwards and sideways, and beginning to go up and down stairs on their hands and knees. What do you do with mobile infants? Provide push toys. Place materials around the room that they can access. Make sure there are low, sturdy shelves in your space that they can pull up on, and give them room to explore. Now we're into the toddler years, 18 months to 3 years old. Toddlers are determined, enthusiastic, and sometimes a little bit unpredictable in their movements. Running and falling go together in this stage, and that's completely normal. Toddlers in this age range are walking easily and beginning to run, though early running really is more of a hurried walk with a lot of falling. By 2 years, most toddlers are kicking a ball with purpose, carrying objects while walking, propelling right on toys with their feet, and beginning to climb. One thing I love about this stage is how physical development shows up in play. A 2-year-old stacking large blocks isn't just doing a fine motor activity. They're also crouching, balancing, reaching, and building spatial awareness. Physical development and cognitive development are always connected. By the end of the toddler stage, children are typically jumping on 2 feet, beginning to balance on 1 foot, and walking upstairs with alternating feet. These are exciting milestones to watch for. While we celebrate variation in development, there are some times when something we might observe might signal that a child needs additional support. So let's talk about some red flags. Not to sound an alarm, but just to prepare you to be an informed observer. W sitting is something to watch for. This is when the child sits with their knees bent outward and their bottom is between their feet, so it looks like they're forming the letter W. Occasional W sitting is common, but if it's a child's preferred position all the time, it can affect hip development, and it should definitely be mentioned to the family. Also, watch for consistent delays across multiple milestones. Not rolling, not sitting, not bearing weight at the expected age ranges. Muscle tightness or a consistent preference for one side of the body are also worth noting. And an immature walking pattern with frequent falling beyond the early toddler stage should be flagged. Your role is not to diagnose. It's to observe, document, and have a caring conversation with the family. Let them follow up with their pediatrician. The preschool years, ages 3 to 5, are when gross motor skills become more refined and impressive. This is when children really start to look like coordinated little athletes. By age 3, most children can stand on tiptoes, jump forward and down from small steps, catch a large ball by trapping it to their chest, walk along a line, and they're beginning to hop on one foot and may start pedaling a tricycle. By ages 4 and 5, the skills become much more sophisticated. Galloping, skipping, hopping on one foot 8 or more times, and standing on one leg for 5 to 10 seconds. These all require coordination across the entire body. 4 and 5-year-olds are also throwing overhand with direction, beginning to catch a smaller ball without having to trap it, and some are learning to ride a bike with training wheels. What strikes me about this age range is how much joy children take in mastering these skills. They want to show you. They want to try again. Your encouragement and the opportunities you create make a real difference. This slide is about you, what you actually do in your setting to support children's gross motor development. And I want to say something important first. You don't need a fancy gym or expensive equipment. You need intentionality. First, schedule movement time. According to the National Association for Sport and Physical Education, children from birth to age 5 should not be sitting still or at rest for more than 60 minutes at a stretch unless they're sleeping. Children crave movement. Your schedule should honor that. Second, set up your environment thoughtfully. Do children have space to run, to climb, to balance? Even indoors, you can use balance boards, tunnels, beanbags, and open space for movement activities. Third, introduce active games. Duck, Duck, Goose, Simon Says, obstacle courses, and the freeze dance. These are gross motor practice disguised as play. And having fun is not separate from learning. It is learning at this age. Fourth, use verbal cues to help children succeed. When a child is learning to gallop and keeps switching feet, a simple cue like keep the same foot in front makes all the difference. You'll see this in physical therapy approaches too. Specific, clear instructions help children build motor patterns. Fifth, honor each child's space. Developmental charts are guides, not rules. Some children walk at 10 months, others at 15 months. Both can be completely typical. Use the charts as a framework, not a judgment. And finally, partner with families. Ask what games and movement activities children love at home. Incorporate cultural traditions and games, and share information about what you're observing. Let's revisit red flags for the preschool years. These are not reasons to panic, but they are reasons to pay attention and have a conversation with the family. By 18 months, a child should be walking independently. By 2 years, they should be able to push a wheeled toy. By 3 years, they should be able to walk downstairs in some fashion. By 4 years, most children can throw a ball overhand and ride a tricycle. If you're consistently seeing a preschool-age child avoid all movement activities, that's also worth noting. Sometimes avoidance signals frustration, anxiety, or difficulty the child doesn't have the words for. Again, your role is to observe, to document over time, and to have a warm, non-judgmental conversation with the family. Early intervention, which is getting a child support before age 3 or during preschool years, almost always produces better outcomes than waiting. Let's close with what I hope you'll carry with you. Gross motor development follows predictable patterns, head to toe, cephalocaudal, and center to outer edges, proxima distal. But every single child gets there on their own timetable. Normal is a wide range. Your classroom environment and your daily schedule are either supporting or limiting children's physical development. This is all within your control. Tummy time, open spaces, active games, and movement-rich routines are not extras. They are essential. Watch for red flags and connect families to resources early. You may be the first adult who notices a child needs support. And finally, when children feel strong and capable in their bodies, that confidence spills into every area of their development, socially, emotionally, cognitively, and academically. The work you do to support physical development is powerful work. Thank you for taking the time to learn about it.